All right, the first thing that we do is warm up. One of the warm-up exercises is to actually do the alphabet by using your big toe as a marker. And you can see as you go through the alphabet that it actually warms up all the muscles that we want to strengthen in your feet. So do this warm-up, go through the alphabet 1 or 2 times after walking around the house for approximately 5 minutes, just to kind of get used to that feel of using your feet. The first exercise that we're going to show you is towel crunches with your toes. You have these little tiny muscles called interossei and lumbricals, which stabilize your toes. We placed a towel over a clipboard because the towel does not glide well on the carpeting, but you could easily do this on tile as well. I would do this about 10 times or across the entire towel, taking about 30 seconds to do it, and then take a few second rest and repeat 3 times. The next exercise is actually heel walking. Rolling back onto your heels actually strengthens the muscles of your anterior shin, which of course need to stabilize your foot. Of course, heel striking is what we're trying to avoid, but by heel walking it strengthens your lower leg. Do this for about 30 seconds, then take a 10-second rest and repeat 3 times. The next exercise is deep squats onto your forefoot. Make sure that you squat all the way onto the forefoot and just hold it there for about 30 seconds. Try to avoid rolling back onto your heels because of course we want to stabilize our toes and build the musculature on the bottom of your foot that it takes to squat. Next exercise is actually using a TheraBand for resistance in order to stabilize the inner muscles or the intrinsic inverters. And as you can see, we've put the TheraBand around the forefoot, and then we use our other foot to stabilize it and just internally invert your foot or bring it towards the inside of your body. What this does is actually strengthen your abductor hallucis, which is basically the muscle that stabilizes your big toe, and your posterior tibial muscle, which is the largest muscle that holds up the arch of your foot. So these are quite important. I would do 10, holding for about 2 seconds each, and then repeat 3 sets of 10. Next set of exercises actually strengthens the outside of your foot or your everters. You place the TheraBand in, again using your other foot to stabilize it, and then just move your foot towards the outside of your body or everting your forefoot. This works on your perineal musculature as well as all of the lateral muscles of your lower leg, basically helping you to stabilize the outside of your foot. I would again do 10 sets of about holding for about 2 seconds and then repeat this 3 times, so 30 in total. Next exercise actually works on your proprioception, which is basically how your foot and where it is connected to your brain in space. So think of it as just like if you move your finger up and down with your eyes closed, you know where your finger is. Well, we want to really get to know where our foot is. So that's balance training. First thing you do is simply balance on one foot. When you get good at balancing on one foot for approximately 1 minute, then you can actually start to roll up onto your forefoot and balance on your forefoot, which is a lot harder. If you get really good at it, you put a 5-pound weight in your hand and actually touch your forefoot. And at this point, I don't think our model can actually do that. So it's actually hard to do this. Another way to make it a little bit more difficult is to add a Bosu ball into the mix. That's a half a ball that's used for core training. And you can see that we now balance on the ball itself, and that's a lot harder. You can also add an intermediate step of balancing on a pillow or on a foam mat type of thing. As you can see, it's kind of hard to do this. All right, and lastly, now that we're done our simple 6 exercises, we have to remember to stretch. And the biggest thing to remember to stretch is your calf. You can simply do it with a cord like it's being shown right now. You could also use a towel, or you could go back and use your TheraBand. You basically want to stretch your calf to the point where you're feeling it, let go just a teeny bit, and hold it there for about 10 to 15 seconds. And repeat that 3 times. Because again, stretching your calf is extremely important. Also, don't forget your lower back, your hamstrings, and the rest of your musculature. But more than anything, stretch those calves. If you don't have a cord or a TheraBand, although you should, you can simply do this by leaning up against a wall or leaning up against a table like this, making sure that you hold that heel all the way to the ground, and then after about 10 seconds of straight leg, then bend the knee slightly in order to get the soleus, which is the lower musculature. Again, remembering to leave the heel on the ground. Stretching is just as important as strengthening. So that was our 6 tips to strengthening your feet. Have fun, and remember, don't do too much, too soon, too fast.